Bestmed has been recognized for its outstanding contribution to the medical aid industry, most recently being voted first in the medical aid category of the 2020 Ask Afrika Orange Index, and also receiving the highest rating in the SA-csi 2021 survey for customer satisfaction. Speaking on the value of a wellness program as part of your medical aid plan today, let's speak to Madelein Barkhuizen, Bestmed's Executive Manager for Sales and Marketing. Madelein, a very good afternoon to you. Welcome to Daytime Update. So, rewards or loyalty programs are on to begin because they've seen significant growth in many industries over the past few years. Talk to us about how these types of programs feature in the medical aid industry.
Thank you, Thembekile. I must say they have grown over the past few years, Thembekile. So these programs definitely play a role in the medical aid industry, and they are actually often a deciding factor when members decide whether they should join a medical aid. If I can perhaps use Bestmed as an example, we offer an extensive wellness program. It's called the Tempo program. And for us, it's important to have a program available that can assist members to manage their health proactively. Mahatma Gandhi said, "It is health that is real wealth and not pieces of gold and silver." So a person's health is probably their most important asset, and therefore it is our objective, but also for many schemes, to support and enable members to take proactive steps to live a healthier life.
And just on that, you touched on it slightly, the importance of a medical aid to have a wellness program.
I think, Thembekile, definitely a wellness program supports members to live healthier lives and also to proactively manage their own health journeys. And importantly, if you have more healthy members, that results in less claims for serious disease, and ultimately then the scheme is also healthy, so everybody benefits. For the member then, if the scheme is healthy, the scheme can provide better benefits and cover for its members and also more competitive contributions. For example, Bestmed is healthy, and we've been able to increase our benefits with more than our contributions. So benefits exceeding contributions for 2 years in a row, 2 successive years. So members definitely benefit from a scheme that is healthy. And then also with wellness programs, many schemes offer what we call preventative care benefits. And the wellness programs with the preventative care benefits are actually both important to allow members then to proactively use their medical aid and not only use it when they are sick.
And just let's talk about what you were just touching on now, how the various wellness programs compare then among the various schemes.
Thembekile, so there are various medical schemes and that offer different programs to their members. So the models actually differ significantly. In some instances, the programs can be purchased as an add-on, so separate from your actual medical cover, and then there are specific requirements for receiving these rewards or earning the rewards. And then other programs are offered free of charge as an additional benefit. If I can perhaps then again use Bestmed, our program is integrated with your medical aid benefits. So it's offered completely free of charge, and the benefits are available to all members on all plans, even our hospital plans or our entry-level plans. And then the benefits are unlocked when you do your health assessment at a participating pharmacy. So any Dis-Chem or Clicks or Van Heerden's pharmacy or Alpha Farm. And then you get access to the benefits. And that can include, for example, in our case, access to 3 appointments with a biokineticist to help you with a training or a fitness program, and also access to a dietitian to help you with an eating plan that suits your lifestyle, And then also access to group classes, for example, Pilates classes throughout the year to again just help encourage and support a healthier lifestyle, regardless of your age or your health status.
You mentioned preventative care earlier, and as part of a medical aid that seems closely related to issues of wellness, how does preventative care tie into the broader picture?
So, Thembekile, I really do think that preventative care is so important, and it's important for members to understand what are their specific preventative care benefits, because most of the schemes actually offer these. And we found that preventative care not only minimizes the risk of illness and impairment later, but it also saves the members the associated treatment costs. And what's important is your cost for preventative care is paid by what we call scheme risk. So the scheme actually pays. It doesn't come from the member's pocket. And then I think people will ask, but what are these preventative care benefits? And examples are, for example, a female contraceptive benefit with us now, where you have access to an extensive list of contraceptives to an amount of 2,412 Rand a year per beneficiary. And again, it's not paid from your savings, it's paid by the scheme. Other benefits include, for example, preventative dentistry. So members can consult with their dentist for a full oral examination to make sure that their teeth and gums are in good health. Things like scaling or polishing, fluoride treatment, and even access for funding for a space maintainer for your little ones are some of the services available on the dentistry benefit. And then this time of year, very important, your flu vaccine or influenza vaccine. Again, at some schemes like Bestmed, that is covered as preventative care, regardless of your age or your chronic illness. And then also biometric screenings, mammograms, pap smears, prostate tests are also included as preventative care benefits. Your pediatric immunization program to ensure that your child dependents are also vaccinated and that these are kept up to date. They're also payable from preventative care. So a member doesn't have to stand in a long line or be subjected to mass exposure for vaccinations. And it is from your newborns up till the last vaccinations that are required for 18-year-olds. So there are so many benefits under preventative care, Thembekile, that you can proactively use. So I think it's really important that people know what these are and use them.
I think you've laid them out quite eloquently, Madelein. Let's talk about some of the other spheres of health and well-being. I'm thinking now about mental health specifically.
I must say that has always been really important, Thembekile, but now after COVID, the problem has worsened a bit. So many schemes also do offer benefits for mental health. For example, Bestmed covers certain chronic medication for major depression on at least 5 of our options. It includes what we call our beat option and then also our full pace range. And then we also have a mental health and chemical and substance abuse benefit that allows members to access a network of mental health clinics or substance abuse facilities for up to 21 days per member. And then also for 2022, when we did our benefit enhancements, our members were always covered for major depression as part of a medicine limit that we call the non-chronic disease list limit. But what is important, what we changed for 2022 is even if that limit is depleted, we continue to fund the medicine so that the member is never without their medicine, because you don't want a period where you cannot access funding for a mental health chronic medicine. So again, I just think it's important that you know what the benefits are that your scheme offers, Thembekile.